Okay, so we just talked about consciousness, and I want to look at practical application because what I'm saying is that Bodytalk is consciousness-based healthcare. Now, in that, we are saying that if we learn to communicate intuitively with consciousness and use it for our direction in addressing situations and with our patients and our clients, we can make a profound difference. Now, this applies not just to Bodytalk. The reality is, if we use this system, this can be applied to every system of healthcare. You can have consciousness-based surgery, consciousness-based prescribing drugs and herbs and things like that, and acupuncture and counseling, because when you're working with the intuitive process, you're able to find out information directly from that intuition, the innate wisdom of the body through your intuition, to establish what you need to address and get direction. And always be doing, therefore, the right thing. You're not experimenting. Try this, see if it works. If it doesn't work or you get too many side effects, let's try this. Why not find out, yes, this is good. And we have people doing that, where they use that process to actually ask if that particular pharmacological drug is going to be beneficial to that patient. And it may say, no, they'd get too many side effects. Well, what about this one? Yes. And how many times a day should they have it? 2 times a day. How many tablets? 1 night and morning, or 2 night and morning. And doing that, we're finding people need less drugs and they're not getting the same side effects. And this is can be utilized in so many different ways. The interesting thing we've noted is that when we use the Bodytalk system, we're using the systems and concepts and that in quantum physics they talk about the world is formed under, the processes of manifestation. And because of that, we find that when we consult consciousness, when it has a choice, it will choose, in most cases, the Bodytalk system, because we're using the protocols and the systems that are in keeping with how manifestation really works. In other words, not the Cartesian model. So that's why in Bodytalk we talk about synchronicity, we talk about tensegrity, integration, contextualization, formatting, and defragmentation. And we talk about matrices and morphogenic fields and the interaction of all the different fields. You see, these are all the fundamental principles of the manifesting process. They're the principles of quantum mechanics and quantum physics. They're the principles by which we're made. Our body is an energy system. It's also physical, but it's energy that creates matter and energy that moves matter. And matter is nothing more than more solid form of energy or consciousness. Okay? So by using these principles, we get told quite clearly that that the Bodytalk system is the one it prefers to go to. It has its limitations, because sometimes it's got to go to the physical model, which means the surgery and things like that. Now, a guideline to all this is a nice little process that Dr. Amit Goswami uses, where he uses the fundamental concept of dividing manifestation up into 5 levels, especially in relation to human beings. He talks about the physical level, and then the vital level or vital body energy level, then the mental level, then the supramental level, and then what we call the bliss level. And he talks about the manifesting process being an a downward process, not an upward process. So everything higher affects everything lower, but everything at the bottom can only affect itself. So what that is saying, from a quantum physics point of view, is that when you are working on the physical body, you can do a lot of things. You can push and pull the vertebrae as a chiropractor. You can do soft tissue work. You can cut them up with surgery. You can use drugs on them and chemicals and things like that. And this can all be great. But it is first aid, because it's only affecting the physical body. It's not affecting the whole person. It's affecting the physical body, so it's only first aid. Now, sometimes it's life-saving first aid, critical first aid, stuff you absolutely have to do, okay? But it's still first aid. And it is restricted to the physical level. If you go one step higher, you're at the vital body. This is the world of acupuncture, kinesiology, all the other energy medicine systems out there. It's part of the world of Bodytalk because part of Bodytalk has some energy medicine techniques in it. But Bodytalk isn't only energy medicine. It incorporates many other fields, okay? But that level is a great level because you can do a lot of great things there. And what's more profound is what you do there is going to go down and affect the physical body. So by affecting that level, you're affecting two levels, both the energy and the physical, which is more comprehensive and very advantageous in some cases, in fact, I think most cases, and in some cases, not strong enough. In other words, when you need surgery. But you've got a greater range of a sphere of influence. You go to the mental level. That's a higher level. Now, that's the level of the actual conscious mind, and that's about belief systems, attitudes, the ways you think, positive thinking, and all that type of thing. And we know that when you can profoundly change the attitudes and the belief systems of somebody, that profoundly affects their health and will spill down, because at that level of the powerful psychotherapy or aspects of Bodytalk, such as breakthrough, we use these techniques, or when we're talking about changing belief systems and attitudes, which are techniques we use in Bodytalk. Then when you work at that level, you're also affecting the energy level and the physical level, so it'll spill through. That's why I've seen work where you've changed someone's belief system and you've actually dissolved a tumour in their lung. It can be that powerful, right? So that's the mental level. Now, the supramental level is the mental of what we call higher consciousness, or you could call it the deep subconscious. But it's the higher level, especially where the right brain is functioning and intuition is functioning. And that is the level at the supramental in quantum physics. It's the level of all those other terms I used, of communication, synchronization, of the matrix fields, of tensegrity, and all those concepts of manifestation, which means that if you're working at that level and you're using those concepts and you're working, and to get to that level, you're working at that level of intuition. By the way, you can work at intuition at the mental level. That's the early stages of intuition, and in fact, in early Bodytalk, in the basic modules, when you're just doing yes and no's, that's probably where you're at, mental level. But when you get into advanced Bodytalk, and your intuition is much more because it's just flowing, you don't have to ask questions, the answer's just flowing to you, you're at the supramental level. And because you're at the supramental level and you're using the principles of the supramental level, such as the principles of synchronization and communication, etc., and entanglement and all those concepts, then you're going to profoundly affect all the levels below it. Therefore, you're working at a completely different system, a completely different level. And of course, in Bodytalk, the way we're set up is we're usually working on all those levels. We're doing that, but we're doing stuff on the mental level, on the energy level, and there are physical techniques in Bodytalk as well. And we let consciousness decide which ones to do in priority and what sequence to do them and how much to do them. That leaves one level left, that's bliss. Now, the bliss level we can only equate to spontaneous healing, so-called spiritual healing. Now, there are cases of that around, but quite frankly, if you want to do that, you probably just have to be a fully self-realized being or something like that, or a guru. And we don't teach that in Bodytalk, although we may teach it eventually in Module 564. But that won't be in my lifetime. So the Bodytalk process is designed to encompass that quantum theory model of treating at all levels. And this is a very important concept that we have. And it's in harmony with the concept of pure science. As I said, we must follow pure science if we're really going to get lasting and permanent changes in society, in people's health, and the way they interact in this world.